Hey guys, how you doing? Mike Galbraith here. I'm a family and sports medicine physician with my partner in crime.
Trevor McArthur. I'm a chiropractor here at Elite Sports Medicine.
And we're gonna try to answer some patient questions for you. So this is Ask the Doc segment. So we're gonna bring it as best as we can. And Dr. McArthur has a question about some injections.
Yeah,
Just so we can do.
So I get a lot of questions from my patients. They hear about some of their friends getting all sorts of injections, and one of the ones that they get is Platelet Rich Plasma or PRP injections for things like their tennis elbow or sometimes in their ankles or things along that line. So what is a PRP injection and what's it good for?
Sure. So maybe we'll start with those two and then you can grill me other ways if you want. So let's see. What is PRP? So PRP stands for Platelet Rich Plasma, and PRP is basically your own blood that we inject into you legally. So sometimes some people have heard of stem cell therapy. This is not stem cell therapy. It's kind of similar to it, where you're using your own tissue to try to regenerate healthy new tissue. So what we do is we have a nurse that comes in, for example. She draws your blood. She takes it to a special centrifuge in the back, spins it down, and it separates out your blood products. So that'll separate out your red blood cells, your white blood cells, and then it's going to concentrate your platelets. What we've known for decades is platelets are really important for clotting blood. So let's say you're bleeding, you need platelets. They're helpful to stop bleeding. But more and more we're learning with PRP that these platelets actually have really important proteins to heal tissue. So basically we take those concentrated platelets with these growth factors and proteins and we inject it into your injury. And then we hope, kind of pray, that maybe your body can start to repair and heal itself. You'd asked about what does it treat? Did you ask what does it treat, or am I just
what are some conditions that it's good to treat? When would you want to get a PRP injection versus other injections?
Great. You can imagine. So PRP really hit it big. Maybe to go back a little bit, there was a big article that came out, a research paper for tennis elbow, about 12 years ago from an orthopedic surgeon out of Stanford, and it showed that for really stubborn tennis elbow, where people had physiotherapy, anti-inflammatory medicines, chiropractic, acupuncture, cortisone injections, kind of throwing the kitchen sink at it, they were still pretty disabled with their tennis elbow. And so that would be a great time where they've maybe failed conservative treatment, where we would do PRP. And we use ultrasound, and we come in under ultrasound and we target right where that, for tennis elbow, would be right on the outside of the elbow. And we inject the patient's platelets there. That's probably the area that we do the most for PRP. It's used mostly for soft tissue like chronic tendonitis, like a rotator cuff tendonitis, Achilles tendonitis, patellar tendonitis, where usually it's not just inflamed anymore, there's like scar tissue. There is some research starting to come out, maybe some benefits for arthritis. It's still a little bit debatable, it's kind of controversial, but it has been done for knee arthritis, hip arthritis, etc. So those are some of the common things, mostly soft tissue, occasionally joint.
Sure. So is it a painful injection? I get that question a lot.
Yeah.
When patients are asking about it, does it hurt?
You bet. So I've had a lot of PRP on me because I'm a train wreck from high school and college, where I played trombone.
Professional sports.
Professional sports mostly. Professional trombone. And I've done a number of PRP treatments and lots of other injections. Generally, does it hurt? I think so. But we do use local anesthetic. So we use local anesthetic, so the procedure itself usually isn't as bad as what they think it would be. So that's the freezing or numbing medicine, like when you go to the dentist.
Right.
And then that wears off within 2 to 4 hours. And at that point, later in the day, you might say, dang, that Dr. G, I don't like him now, my elbow's sore, because we've kind of woken up the beast. We're trying to inflame it and get the body's immune system to the area.
Awesome.
So that's a little bit about PRP, or platelet rich plasma injections. So we offer PRP injections here at Elite Sports Medicine. And again, it's usually when someone's been unresponsive to a lot of conservative stuff. It's not a service covered by Alberta Health, so it is pricey. So we often try to make sure someone's had the appropriate rehab and treatment beforehand. But when indicated, it can be very appropriate. And hopefully, here's to you and your healthy tendons.
There we go.
Yeah. Have a great day. Thanks, guys.
Thanks.